Part A. Extract 1. Questions 1 to 12. You hear a GP talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. How are you today?
Morning, doctor. Well, not great, actually. My foot pain is just unbearable at times.
I see. Could you tell me exactly what's been going on?
Yeah, it's been this on and off pain, mostly in my heel. At first, I thought maybe it was just soreness from walking too much or maybe new shoes, but it's been persistent for, let me think, probably about 6 months now. The pain feels sharp, almost stabbing when I first stand up in the morning.
6 months. Is it both heels or just one, Mihiraa?
No, just the right one. It starts sharp and then turns into this throbbing ache, especially if I've been standing for a while, like if I'm at work or cooking in the kitchen for long periods. By the end of the day, I can barely put weight on it.
Right. And when you say it's worse in the mornings, are you talking about the moment you first put your foot down after getting out of bed?
Oh, yes. Exactly. That's when it's the worst. First thing in the morning, I get this really intense, sharp pain. Then, as I start moving, it sort of eases up a little, but it never really goes away. And if I sit for too long during the day, it happens again when I stand up.
That sounds quite uncomfortable. Now, Mihiraa, have you noticed if this pain has impacted your day-to-day activities?
Oh, absolutely. I mean, walking is painful. I used to go for morning walks, but that's out of the question now. And at work, I'm a teacher, so I'm on my feet all day. By lunchtime, I'm limping. Even doing simple things like going to the supermarket or climbing stairs is exhausting. Sometimes, if it gets bad enough, I just have to sit down in the middle of whatever I'm doing.
All right, Mihiraa. What have you tried so far to relieve the pain?
Yes, I've tried a few things. I started with ibuprofen, but they don't really help much. Then, I tried some cushioned shoe inserts. I think they're called orthotics. Oh, and I've been icing it at night, which helps with the pain sometimes, but not always. But they only seem to make a small difference. My mom recommended soaking my foot in warm water with Epsom salt, which feels nice, but doesn't last long in terms of relief.
It sounds like you've been trying a few different approaches. Let me ask, has anyone ever mentioned plantar fasciitis? Well, it is a bony growth that forms on the heel bone. It can cause the type of pain you're describing, especially in the mornings. The pain tends to be worse when you first stand up, just like you said.
Oh, that sounds exactly like what I've been feeling. So, what now?
Yes, Mihiraa, that's likely a good next step. An X-ray can help confirm if there's a heel spur. I'd also recommend a physical examination to assess your foot's mobility and tenderness.
Okay, let's do it.
Extract 2. Questions 13 to 24. You hear a pediatrician talking to a parent called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. I understand you're concerned about Milan. Could you tell me what brings you here today?
Yes, doctor. I'm really worried about Milan. Over the past few days, he's been complaining of severe headaches, and he's also been vomiting quite a bit. He's very drowsy, and it's like he's just not himself.
That sounds concerning, Mihiraa. How long have these symptoms been going on?
It started about 2 or 3 days ago. At first, I thought it was just a stomach bug, but it seems to be getting worse, not better.
I see. How is Milan feeling emotionally and physically?
He's been very lethargic. Normally, he's such an active child, but now he seems exhausted all the time. Even when he's awake, he's irritable and confused. I've also noticed he's been a bit disoriented at times. He doesn't seem to know where he is or what's happening.
That must be very stressful for both you and Milan. Has he had any fever, rash, or other symptoms that you've noticed?
No fever or rash, doctor. But he's also been refusing to eat much, and I'm worried about his dehydration because he's not keeping liquids down either.
All right, Mihiraa. Have you given him any medications or tried any remedies to help with the symptoms?
Yes, I gave him some ibuprofen for the headaches, and my husband gave him aspirin the other day to try to bring down what we thought might be a fever. We've also been giving him oral rehydration solutions, but it's hard for him to keep anything down.
Aspirin, you said? I'm glad you mentioned that. I need to gather a bit more about Milan's medical history. Has he had any recent illnesses?
Yes, he had the mild flu about a week and a half ago, but he seemed to recover just fine. That's why I'm so confused about all of this now.
Based on what you've told me so far, Mihiraa, I'm concerned that Milan might be showing signs of something called Reye syndrome. It's a rare but serious condition that can affect the brain and liver, especially in children who've recently had a viral infection and taken aspirin. The use of aspirin in children with viral infections can sometimes trigger this syndrome.
Oh no, doctor. I had no idea.
Mihiraa, we'll arrange for Milan to have blood tests to check his liver function, as well as a lumbar puncture to assess for any neurological involvement.
That sounds painful.
It can be uncomfortable, but we'll use local anesthetics to numb the area. It's essential to get an accurate diagnosis. We'll also do an MRI or CT scan of his brain to check for any swelling or other abnormalities.
I see.
If the diagnosis is confirmed, Mihiraa, treatment will involve managing the symptoms and preventing further complications. Milan will likely need to be hospitalized for monitoring, particularly to ensure his brain and liver are functioning properly. We'll provide intravenous fluids to prevent dehydration and medications like mannitol to reduce any swelling in the brain.
I understand. I just want to do whatever is best for Milan.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. You'll have time to read each question before you listen. Now look at question 25. You hear a nurse called Mihiraa talking to a colleague. Now read the question.
Hey, Jamie. Did you check the readings from the new infusion pump in room 4? I've noticed it's been fluctuating. It reminds me of the issue we had last week with the oxygen monitors, but this time, it's not just the flow rate that's inconsistent. The alarm system goes off sporadically, even though the dosage settings are correct.
Yeah, I did. At first, I thought it was just like the problem we had with the BP monitors last month, those false high-pressure readings. But it seems different. Did you recalibrate it, Mihiraa?
I did it twice. The weird thing is that the primary function works fine when you set the flow manually, but the moment it switches to automatic, that's when the issues start. It's not a programming error because the software update from last week should have covered that. The alert system shouldn't be this sensitive unless there's an internal wiring fault.
That's strange, Mihiraa. So, it's not the flow, not the dosage, and the settings are fine manually. Could it be a sensor misalignment?
Exactly. It's the internal sensor not picking up the correct flow when on auto. I think we'll need to get it serviced.
Now look at question 26. You hear a care home manager called Mihiraa talking to a staff nurse. Now read the question.
Nurse Russell, I'm concerned about Mr. Paulson's condition. He's been admitted to the hospital for several days, and his recovery seems to be slower than expected.
Yes, Mihiraa, I've noticed that as well. His vital signs are stable, but he's still experiencing some discomfort.
We should review his medical records and assess his progress. Have there been any complications or setbacks?
He's been responding well to the treatment, but his mobility is limited. He's having difficulty getting out of bed and walking around.
That's concerning. We need to ensure he's receiving adequate physical therapy to help him regain his strength and mobility.
I've been working with him on exercises to improve his range of motion. However, he seems to be experiencing some pain.
We should consult with the physical therapist to adjust his treatment plan if necessary. It's important to manage his pain effectively to facilitate his recovery.
Mihiraa, I'll schedule a consultation with the physical therapist and discuss Mr. Paulson's progress.
Now look at question 27. You hear a social worker called Mihiraa talking to a staff nurse. Now read the question.
Nurse Russell, I'm concerned about Mr. Paulson's social isolation. He lives alone and has limited social interactions.
That's a valid concern, Mihiraa. Social isolation can have a significant impact on mental and physical health.
Mr. Paulson has expressed feelings of loneliness and depression. He's also struggling with daily activities due to limited mobility.
We should assess his functional status and identify any barriers to social participation. Perhaps a home health aide could provide assistance with daily tasks and help him connect with others.
That's a good idea. I'll explore the possibility of home health services. We should also consider connecting Mr. Paulson with social groups or community activities that align with his interests.
That's excellent, Mihiraa. Social interaction can be beneficial for his mental and emotional well-being.
I'll reach out to local community organizations and see if there are any suitable programs for Mr. Paulson.
Now look at question 28. You hear an administrative called Mihiraa announcing new cleaning regime. Now read the question.
Team, I'm excited to announce that we'll be implementing a new cleaning regime to enhance the cleanliness and hygiene of our workplace. This initiative aligns with our commitment to providing a healthy and safe environment for all staff and visitors.
That's great news, Mihiraa. What changes can we expect?
We'll be increasing the frequency of cleaning in common areas and high-touch surfaces. Additionally, we'll be introducing new cleaning products that are more effective against germs and viruses.
Will this affect our daily routines?
There might be some temporary disruptions during the initial implementation of the new regime. However, we'll strive to minimize any inconvenience and ensure that cleaning activities are carried out efficiently.
Are there any specific guidelines or protocols we need to follow, Mihiraa?
We'll provide detailed guidelines and training sessions to ensure that all staff members are aware of the new cleaning procedures. It's important to follow these guidelines to maintain a clean and hygienic workplace.
Now look at question 29. You hear a GP called Mihiraa talking to an attending physician. Now read the question.
Dr. Russell, I'm concerned about Mr. Paulson's response to the new medication. He's been experiencing side effects such as nausea and dizziness.
That's concerning, Mihiraa. Let's review his medication history and identify any potential interactions.
I've checked for any known interactions, but I can't find any that would explain these side effects.
It's possible that Mr. Paulson is experiencing an idiosyncratic reaction to the medication. These are unpredictable and can vary from person to person.
That's a possibility. We should consider adjusting the dosage or switching to an alternative medication.
Mihiraa, let's discuss the potential risks and benefits of adjusting the dosage or switching medications. We need to weigh the severity of the side effects against the effectiveness of the medication.
I agree. We should also monitor Mr. Paulson closely for any worsening symptoms. If the side effects become intolerable, we may need to discontinue the medication.
Now look at question 30. You hear a triage nurse called Mihiraa talking to a carer. Now read the question.
Hello, Mr. Russell. I'm Mihiraa, the triage nurse. Can you please describe your patient's symptoms?
My father has been feeling unwell for the past few days. He's complaining of chest pain and shortness of breath.
Has he experienced any other symptoms, such as dizziness or nausea?
Yes, he's also felt a little dizzy.
Can you rate the chest pain on a scale of 1 to 10, where 1 is the least painful and 10 is the worst?
It's about a 7, Mihiraa.
We'll need to assess his vital signs and conduct some tests to determine the cause of his symptoms. Has he had any recent injuries or illnesses?
He had a recent cold, but he's recovered from that.
We'll need to rule out any underlying medical conditions. Has he had any previous heart problems or chest pain?
Not that I'm aware of.
That is the end of Part B. Now look at Part C. Part C. Extract 1. Questions 31 to 36. You now have 90 seconds to read questions 31 to 36. You hear the conversation between a psychiatrist, Dr. Mihiraa, and an interviewer. Dr. Mihiraa, thank you for joining us today. Exam stress among children has become an increasingly visible concern. I understand you recently conducted a study on this topic. Could you tell us what led to this study on exam stress in children?
Thank you for having me. The rising attention to children's mental health over the last decade was one of the primary reasons that inspired this study. But it wasn't just the data that drove our interest. Anecdotal evidence, which included teachers and parents expressing concerns about children struggling emotionally, made it impossible to ignore. We also noticed an uptick in clinical cases where young patients would come in with symptoms that seemed deeply rooted in their academic pressures, often stemming from upcoming exams. So, it wasn't any one factor, but a confluence of signs, from increased cases of school absenteeism during exam periods to heightened anxiety in students across all grade levels, that made it clear we needed to investigate further.
That's very interesting, Dr. Mihiraa. After diving deeper into this issue, what were some of the key findings of your study?
Our findings were both surprising and concerning. We discovered that the level of stress in children during exams had spiked significantly compared to previous generations. One of the most striking aspects was that children as young as 10 were reporting physical symptoms like headaches, nausea, and sleep disturbances leading up to their exams. We also found that this wasn't limited to high-performing students, it was pervasive across different academic levels. Furthermore, it wasn't just the immediate pressure of the exam itself. Anticipatory stress, children fearing the repercussions of not performing well, had a lasting effect on their overall well-being. Interestingly, even those who performed well often expressed feelings of emptiness or imposter syndrome, believing they hadn't done enough despite achieving high scores.
That's quite alarming. In your view, Dr. Mihiraa, what could be contributing to this increase in exam-related stress among children?
There are several layers to this issue. Firstly, I believe the societal focus on performance and achievement has intensified. Success is often equated with academic accomplishment, and this message is deeply ingrained in our education systems and family structures. Additionally, the role of technology can't be underestimated. Children today are exposed to a constant stream of comparisons, be it through social media or the competitive nature of educational platforms that rank students against their peers. There's also parental pressure, which has evolved from just doing well to being the best in many households. Moreover, the curriculum itself has grown more demanding, with younger children facing expectations that once applied to much older students. All these elements together contribute to the rising tide of exam stress.
Given this complexity, what do you think about potential resolutions for this growing problem, Dr. Mihiraa?
Resolving this issue requires a multifaceted approach. First, we need to redefine the way we talk about success, both in schools and at home. Education shouldn't just be about marks on a report card, but fostering holistic development, including emotional and social skills. Schools can play a big role by revising their assessment strategies. For instance, moving away from high-stakes exams as the sole measure of a child's ability and embracing more formative assessments could help ease the pressure. At the same time, mental health support within schools should be normalized. Children must feel comfortable expressing their anxiety and seeking help without the stigma that often comes with discussing mental health.
I agree, Dr. Mihiraa, but how can these strategies actually be implemented in practice?
Implementation is undoubtedly the more challenging part. Schools will need to take the lead by providing mental health professionals on site and training teachers to identify early signs of stress. Incorporating mindfulness programs and stress management workshops can also help children develop coping mechanisms. On a systemic level, education boards need to consider restructuring curriculums to be less performance-driven. Furthermore, schools must foster environments where children feel safe making mistakes and learning from them, rather than fearing failure. But schools can't do it alone. Policymakers need to support them by allocating funding and resources for mental health programs, which unfortunately are often the first to face budget cuts. Lastly, collaboration with tech platforms is essential to manage the impact of online learning and social comparisons that exacerbate stress.
It sounds like collaboration is key. What role do you think families and teachers should play in alleviating this stress, Dr. Mihiraa?
Families and teachers are undeniably crucial in this effort. In the family context, parents need to reassess their expectations and be mindful of the language they use when discussing academic performance. Instead of emphasizing grades, they should focus on effort, improvement, and resilience. This can shift a child's mindset from one of perfectionism to one that values learning as a process. It's also essential for parents to create an open line of communication where children feel comfortable discussing their fears without judgment. Teachers, on the other hand, need to strike a balance between maintaining academic rigor and ensuring their students' emotional well-being. By recognizing early signs of stress, like a change in behavior or disengagement, teachers can intervene before the pressure becomes overwhelming. Moreover, fostering classroom environments that encourage cooperative learning rather than competitive achievement can help diminish the anxiety associated with exams.
Now look at Extract 2. Questions 37 to 42. You hear a nurse, Hilton Ketwick, talking about a latest government initiative. You now have 90 seconds to read questions 37 to 4b.
Good morning, everyone. I'm delighted to be here today to speak about an ambitious new government initiative, Mihiraa Care. As a nurse who has witnessed the ups and downs of our healthcare system firsthand, I am particularly excited about this initiative. It's a breath of fresh air in the world of public health, and today, I'll explain what Mihiraa Care is, how it's set to transform the public health system, and how it impacts both healthcare professionals and the public. There are, of course, some challenges, but let's take a closer look at this promising venture. Mihiraa Care aims to set up a community health center for every 100 households across the country. What makes this initiative truly unique is its nurse-led approach. At the core of each center is a dedicated team of 4 nurses who are not just support personnel, but the backbone of primary healthcare in these centers. This model empowers nurses to provide direct healthcare, ranging from basic medical consultations to preventive care, reducing the overwhelming burden on hospitals and large medical facilities. In this framework, nurses are granted an expanded role. Beyond offering routine medical care, they monitor chronic illnesses, administer vaccinations, and ensure follow-ups for various health conditions within their designated communities. Additionally, they are trained to identify early warning signs of diseases and provide mental health support. By doing so, the Mihiraa Care initiative seeks to reframe how healthcare is perceived at the grassroots level, with nurses positioned at the forefront of care delivery. ensuring that the quality of health services extends beyond the traditional limits of a hospital-centric system. This initiative is poised to fundamentally alter how public health is managed in our country. First and foremost, the establishment of community health centers means that medical resources will be much closer to the people who need them most. Imagine having a health facility right within a short walk from your home. This will drastically reduce the need for people to travel to urban hospitals for basic care, which in turn reduces overcrowding in large medical facilities and streamlines access to specialized treatment for more severe cases. Furthermore, Mihiraa Care has the potential to significantly enhance preventive health care. By embedding health monitoring within communities, the initiative encourages regular checkups and early detection, which are often neglected when healthcare centers are too far away. This proximity will lead to earlier interventions, preventing minor health issues from escalating into life-threatening conditions. The overall public health system will thus experience fewer hospital admissions for preventable conditions and a reduction in the pressure on emergency services. Traditionally, doctors have been the decision-makers in healthcare, with nurses playing a more supportive role. Mihiraa Care, however, turns this dynamic on its head. By giving nurses increased autonomy, the initiative challenges the traditional hierarchy and redefines the role of nurses within the healthcare system. Nurses are now equipped with both responsibility and authority, making decisions on patient care at a level previously reserved for physicians. While doctors will still be involved in more complex cases, Mihiraa Care is promoting a more horizontal hierarchy where nurses and doctors collaborate rather than following a rigid top-down structure. This shift not only empowers nurses, but also helps in optimizing human resources. In a country where the ratio of doctors to patients is skewed, Mihiraa Care helps fill the gap by delegating responsibilities to trained nurses who can handle a large portion of the population's healthcare needs. The revamped hierarchy ensures a more fluid and efficient system where each healthcare professional works to their strengths. So, how successful will Mihiraa Care be? If we consider the initiative structure and its early outcomes from pilot runs, the future seems promising. The initial data shows a significant decrease in hospital visits for minor ailments and preventive care procedures. Communities where Mihiraa Care has already been trialed are reporting higher satisfaction with healthcare services, primarily due to accessibility and the personalized attention they receive. That said, success won't just depend on numbers. It will also rely on how well communities adapt to this shift in healthcare delivery. There will be an adjustment period, as some people are used to only seeking medical help in hospitals. However, with continued education and awareness programs, we expect people to see the benefits of this localized, nurse-driven care model. From a nursing perspective, Mihiraa Care represents a huge leap forward in professional development. Nurses are being granted the respect and authority that many have long sought. Being able to take charge of healthcare within a community fosters a sense of ownership and pride. Nurses involved in the trial runs have expressed a high level of job satisfaction as they feel their skills are being fully utilized and they are able to make a direct, positive impact on people's lives. The collaborative atmosphere within the Mihiraa Care framework also enhances job satisfaction. Instead of being relegated to a supporting role, nurses now work in teams, make critical decisions, and interact more closely with their communities. In a profession where burnout is common due to stressful work environments and hierarchical pressure, this new model offers a refreshing and fulfilling change. Despite its numerous advantages, the Mihiraa Care initiative hasn't been without its challenges. In some of the trial runs, logistical issues such as inadequate medical supplies and communication delays between the centers and larger hospitals have been noted. These problems need to be addressed for the initiative to reach its full potential. Another issue that has emerged is the occasional resistance from the public, who may initially distrust the idea of receiving primary care from nurses rather than doctors. Adjustments are needed to enhance the coordination between local centers and higher-tier medical institutions. Furthermore, providing nurses with more advanced training and introducing public awareness campaigns can help mitigate resistance. It's a matter of refining these elements to ensure that Mihiraa Care functions as smoothly as possible, which, given its promising start, seems entirely achievable. In conclusion, Mihiraa Care is more than just a healthcare initiative. It's a transformative approach that reimagines how healthcare is delivered and managed. By placing nurses at the heart of this initiative, Mihiraa Care is poised to improve accessibility, reduce the burden on hospitals, and enhance preventive care in the community. While challenges exist, the overwhelming potential of this initiative promises a better, more inclusive future for public health.
That is the end of your OET listening test. Now check the answers.